Hello, everyone. Thank you so much for joining us today. Today, we're going to talk about GeneRx and how to use your patient's raw SNP data from 23andMe and create a personalized health analysis and treatment protocol. I've been absolutely blown away with this genetic report, how you can customize it. It is absolutely amazing. You get so much clinical data that you can use to really individualize and optimize your patient's health. Today, joining us is Dr. Kendall-Reed. She is the naturopathic doctor who's actually created this report. And thank you so much for being here and taking time out of your busy schedule to educate us on what is GeneRx, what makes it different, as well as we're going to review some sample reports so you guys can really get a good idea of exactly what this looks like and how you can use it for your patients in your practice. So Penny, thank you so much for joining us. Let us know a little bit about yourself to start, and then we'll dive into this awesome report.
Absolutely. Thank you so much for having me, and thank you everybody for joining us. GeneRx is basically the culmination of 10 years of my research within genetics. Prior to practice, when I was just in practice, I would see so many patterns that were frustrating. Two patients would present with a very similar picture clinically, and I would put one patient on the gold standard treatment protocol for that, and they would do really, really well. And the next patient wouldn't respond at all, or may even have adverse reactions. Similarly, you would walk into a store, a bookstore, and see just rows and rows and rows of different diet books, or I'd read different research papers and think, okay, well, keto diet, that looks really good. It's got a lot of good research behind it and people respond well. But at the other end of the spectrum, a more higher carbohydrate vegan diet would also create similar results. So where was this discrepancy coming from? And it's coming down to our genes. And we all understood when we went through school, one of the first things that we were taught was ask about family history. Because we understand that if somebody has a parent who had cancer, we're in a higher risk category. But what we don't actually realize is that same philosophy, it applies to absolutely everything when it comes to our health, our diet, inflammation, our immune response. And so this is what started to get me really excited about genes. And I started reading about SNPs, the single nucleotide polymorphisms. And to me, that sort of made sense as to where this discrepancy was coming from. And I've done an awful lot of research with it. Before I even tested, even myself, I wanted to know with respect to genes, are they valid? And once I discovered that, yes, absolutely, they certainly were valid, was there something that we could do about it? Because the last thing I wanted to read for myself or hand a patient was, oh gosh, you've got this gene, good luck. So I wanted to make sure that the genes or the SNPs were actionable, that we could do something with them. And we know that every gene essentially has an on and an off position. And it's our job as healthcare practitioners to look at how a patient codes for that gene and say, this is a great coding. So I want to make sure it stays in that position, or this is not so great of a coding. We want to turn it off. And we have so many tools within our naturopathic spectrum to which we can do that. But as I sort of got further into it, I was discouraged by the different types of analysis that were coming out with genes in most of the reports. People weren't looking at how the genes interact with one another. And that is absolutely key. You can't treat gene by gene because they all interact with each other, and each individual coding for a gene then changes how it interacts with a different specific coding. A really quick example, and scroll down here, there are three main genes which control how somebody responds to carbohydrates. And those are TCF7L2, IRS1, and GIPR. Most reports, if they look at all three of them, they'll give you this. TCF7L2, you are variant, which means you've taken two of the not so good genes from your parents, or you're red. Red means two of the bad genes again. So you don't respond well to carbohydrates, you need to restrict them. With IRS1, you're normal or green, so you took two of the good genes. You do respond well to carbohydrates, you don't need to restrict them. And then GIPR, you're heterozygote, you took one good one and one bad one, or you're yellow. So you respond less well to carbs, you sort of need to moderate them. Well, what does one do with that? Do I eat them? Do I not eat them? By how much? And what does respond well mean? So with GeneRx, what we're going to look at is what you code, absolutely, for those genes, giving you the allele. But what does that really mean? How much insulin are you making? Are you increasing inflammation in your GI tract? Are you stimulating cancerous pathways through carbs? And exactly how much you need to eat per meal. And this applies to every different section that's in the report: metabolics, carbohydrates, fats, protein, dairy, serotonin and dopamine, long and short-term stress responses, cardiovascular exercise and cardiovascular health, resistance training, injury susceptibility and prevention, immunity, inflammation, phase 1 and 2 detoxification, vitamins, minerals, methylation, and estrogen and testosterone. So there's a lot of information. We're going to go through a sample report so you can see where is it that I actually zone in on and where do I start with this. The other thing that's really key with GeneRx, and we'll show you this, is that the reports are editable, which means if you don't like one of the recommendations or the product that I've suggested here for use, you can go in and change that section and use a different product that you might use in your practice. Or if a patient isn't expressing that gene, for instance, they may actually produce very little dopamine. So in the report, it might suggest something to increase dopamine, but you also know that that patient exercises every single day. And so they increase their dopamine production that way. You can go in, take out all the product suggestion and literally type that in. I know that you exercise really well, so we're going to support your dopamine that way. And so it really allows you to customize it specifically to your patient.
That's one of the things that I really love about this report is being able to customize it, brand it to your practice, as well as it's so specific, like you said, with the carbohydrates, fats, and proteins. Oftentimes you'll get a genetic report back, and like you said, if it just says, you know, moderate or restrict, you don't know exactly to the gram what that's supposed to look like. And with this report, once I get the grams, I can tell my holistic nutritionist, this is what essentially they should be eating. And then they can develop a customized nutrition plan for that patient, which makes it so incredibly user-friendly.
Exactly. And the patient also sees that, you know, they see that, oh my gosh, she's actually in this report, there's something really specific to me. They know that I exercise and don't need the dopamine. So they know that this is your report as their doctor, versus just something that is printed off. All the reports are also white labeled. So it looks like it's coming from your practice and you can put your logo on it. The other really important thing that GeneRx does is, in terms of privacy sake, when you upload a raw data file into it, and I'll show you how to do that, it will automatically scramble the data as it's uploading so that if somebody did ever hack the site, they can't have access that or interpret that raw data. I can't even go through the back door and interpret that raw data. So there's an extra layer of protection there. So let's sort of go through what we would do. This would be the screen if you put in GeneRx.ca that comes up, and you would just click on Get Started. You would put your name, your license number, your email, create a password for an account. And there are two different reports you can get. One is a healthcare practitioner, which is what we're talking about today. And one is if you're a personal trainer, which is just the diet and exercise parts. And then there is a disclaimer, which you just need to click and you create your account. So what I'm going to do is show you what my account is. So I'm going to go in, and what will come up is a page like this once you've logged in and created your account. Then you will proceed to dashboard, and there's multiple pages that you can scroll through, but I'm going to go to the one file that we chose to look at today. You would hit on it. So this is the report that's going to come up. It's not in a PDF format right now, because once you save the PDF, you can't edit the PDF. You could go back into your account and edit it, but you want to do the editing first. For each of those sections that we spoke about, there's a recommendation section. So for instance, recommendations for metabolics, carbohydrates. In the first few pages, all of these summaries are listed at top. So you could just print off the summary section for your patient if they didn't want the whole report. And then it comes down to the actual report. And this is where we get into things gene by gene. Now, this patient has remarkable genes. So I've also pulled up my report, which is going to be on the right-hand side here so that we can show a comparison. So the first section is metabolic. And this deals with the production of leptin, adiponectin, ghrelin, PPAR, so thermogenesis, adipogenesis, and everything around that. So each section is going to give you the name of the gene, the exact RS number, a description about each of the genes, and then it's going to tell you what is the normal allele, what is the variant allele, what the patient code, so this patient is homozygote normal, and then it gives a quick key reference. So these are all characteristics of the C allele, not the T allele. So MC4R is a gene which really deals with ghrelin and leptin. So this is a patient who has a good low production of ghrelin, so they're not hungry as much, and a good basis of leptin, so blood sugar stability and less food cravings. This really decreases their weight, their increase in weight. It decreases their BMI, decreases their risk of diabetes. Then there are two genes, adipoQ. Again, we're going to go through what adiponectin is, which is just a hormone which controls fatty acid oxidation, blood sugar levels, insulin levels. The first adipoQ is how much adiponectin, that hormone that they make when they're eating their genetic diet. And this individual makes slightly less than the average because they're not the normal alleles, the homozygote normal, they're not the variant, but they're heterozygote. So a little bit less adiponectin when they eat their genetic diet, and this is a secondary adipoQ, how much adiponectin they make when they're on a weight maintenance. So do the yo-yo diet? And this person might do a little bit. Then we have a gene which talks about how stress impacts the fat cells, specifically, not the rest of the body, but just the fat cells, and how that impacts the metabolism. We have PPAR gamma, which is a gene which makes a protein that when that protein is in high concentration, it will turn off all of the other great metabolic genes, and it produces inflammation. This patient is normal here again. And then we have FTO, which deals with all three of those metabolic hormones, adiponectin, leptin, and ghrelin, and will also tell us how much protein they need per meal. So they're also normal here. So this is where putting all of those genes together, how this patient codes for each of them and how they interact, her section is pretty basic. She's basically got almost normal adiponectin, leptin, and ghrelin levels because she was normal for almost all of them. So her ideal would be 3 meals a day with no snacking, leaving 5 to 6 hours in between meals. They can have water, coffee, tea, but nothing over 25 to 30 calories in between meals. This would be where you could edit. So if you wanted to edit that, you just click this button. You can go in here, type whatever you wish, and then you hit the save section. When you hit save here, this recommendation section that went up into the summary automatically changes the one above. So to show you just a little bit of a difference, this is my metabolic report. So with MC4R, like this patient, I was normal. adipoQ, I'm normal for the first one. I'm heterozygote for the second one. Normal for ADRA. Normal for PPAR, but I'm variant for FTO. So this has a big impact on the adipoQ as well. So you can see that my section is completely different in terms, I have much lower levels of adiponectin, I have altered leptin sensitivity, I have a slower metabolic rate, and that encourages adipogenesis, which is the formation of fat. I have increased ghrelin, which will make me seek out food-seeking behaviors, and I have a lower thermogenic rate. So I am a good candidate for intermittent fasting. I explain what that is, explain about the meal timings, and as well using a supplement called TMC, which will regulate out adiponectin, leptin, and ghrelin. And so they'll do this consistently and then rotate. I do it consistently for 8 weeks, and then I rotate it in 1 week out of every 4 to 6 weeks. Changing those hormones has completely changed my desire for food, my metabolic rate, how easy it is for me to say, I don't need that, and maintain a normal weight loss. So you can see how different coatings really present with differences in terms of therapeutic recommendations.
And I think that it's really important, again, that this report, you're able to edit it, because even though the report on the left, her metabolic genes looked pretty good, but she essentially could have overridden that with dietary and lifestyle changes that maybe weren't so great for her genes. So being able to edit it, looking at, okay, you know, your genes are good, but if we look at your labs, we see that maybe your HbA1c is increasing. So, even though your genes are good, we kind of have to clean that up a little bit to get back to that foundational level.
You're absolutely right. And then this will tell you where you need to hone in on. Is it adiponectin? Is it leptin? Is it ghrelin? Also, too, stress will turn 90% of genes to their adverse position. So if it's somebody who has remarkable genes, but they've been through a lot of stress, not only do we need to treat the stress genes, but that's another place, just as you're saying, that we need to go back and tidy up some of the metabolic genes or whichever category we're looking at. So then if we get into the diet section, and I'm not going to go through each of those sections because we'll be here for a long period of time, but again, just to give you an example of how they integrate, and I'll use some of the bigger ones that we use as naturopaths, such as diet and detoxification, and maybe an example of one of the hormones. So when we spoke about those 3 genes on that front page, the home page of GeneRx, TCF7L2, this is one of the major diabetic genes. It's one of the biggest ones. It is the largest risk factor for glucose regulation, insulin production, and inflammation in the colon. Whereas IRS1, this is when somebody eats carbohydrates, do they start triggering different kinase pathways in the body, particularly IGF-1 pathways and P13K pathways. The P13K pathways are pathways that are involved in cellular proliferation, differentiation, and thus cancer. So it's one thing to say I might put on weight with carbohydrates, and you may have a very skinny or slim patient and they can get away with eating carbohydrates because they code normally for TCF7L2. But if they're variant for IRS1, I want to downgrade their carbohydrates because they're creating, stimulating cancerous pathways from them. Similarly, GIPR, this is a gene which upon the consumption of carbohydrates, yes, will increase insulin more so, but it creates a lot of inflammation in the GI tract. So sometimes we have a lot of patients who they think it's gluten sensitivity and then they remove the gluten, but they still get a lot of the symptoms because they're still eating gluten-free carbohydrates. And this is one of those big genes. So again, we have to look at all of those together. This patient was normal for this, so the amount of carbohydrate they get is a little bit higher. But still, what we want to say is you're not that sensitive to carbohydrates. She's pretty much making the normal amount of insulin, but they're making more inflammation in the GI tract and down cancerous pathways. So what do we want to do? We want to keep grains, starches, sweets, fruits, and alcohol, all of those simple carbohydrates, which are listed right here below, to a max of 3 meals a day, where the physical size of that carb is 2/3 the physical size of the protein. So smaller than the protein. Vegetables and salads we can use free for all. Again, my carbohydrate genes, not nearly as good. If we look over here on the right, I'm heterozygote for TCF7L2. I'm variant for IRS1, and I'm heterozygote for GIPR. So I get way less. With mine, I have to keep them to a much lower concentration where I only get them at 2 meals a day, and the physical size of the carb is half the physical size of the protein. So again, it all starts to, and then I want to use some glutamine to help regulate out the inflammation in my bowel. So you can see how each combination creates a different pattern. So we have a similar response with fats. FAD-P2 and ApoA2, they both talk about when you eat a saturated fat, how much of that fat do you actually absorb through your bowel, go into making cholesterol production, LDL, go into adipogenesis and increasing weight. And again, this individual is normal. So this would be the type of person who is actually catered towards a keto diet when they are normal here and here. They don't have to, but they could do without creating inflammation. If you are heterozygote or particularly variant, especially for ApoA2 and also FAD-P3, you are not a candidate at all for keto. Yes, you may lose weight when you first start it because everyone loses weight when we cut out sugar. But if you're variant for these genes, you'll actually start to really increase inflammation with higher consumption of saturated fats. So for this individual, and we also combine it with FTO, they get about 40 grams of saturated fat per day, which is, if you're eating a healthy diet, it's pretty difficult to do. Whereas for myself, I'm at the 28 gram mark, whereas my husband is at the 22 gram mark. So we're all slightly different depending on our genes, but you're getting an actual gram count for each of them. If I'll whip over to mine very quickly with respect to the fats, if you do need to really lower the fats beyond, so again, because I'm 28 grams, there's also a food source list. So it will show you exactly, like 1 tablespoon of MCT oil is 14 grams of saturated fat right there. So this list.
And I see that all the time too. Like I'll have patients who are on a paleo keto-ish diet. They're very health conscious. They're exercising. They're doing everything right. Then we run their cholesterol panel and the lipoprotein particle size. And if we had have done their genetics at the start, we could have said, okay, you know, yes, for some people, this can be a really healthy diet, but for you, based off of your genetics, that amount of saturated fats is not doing you any services. So really looking at, okay, coconut oil, red meats, for some, it's really great. And for others, it's not, where this really highlights that.
You're absolutely right. It tells us who has an inflammatory and cardiovascular risk with it, because we all just sort of look at, oh, if you're slim, then you must be healthy. But we know as practitioners that that's not the case. And just because you might feel a bit better off of carbs and your energy goes up, etc., that still doesn't mean that you're designed for keto. And it can have big ramifications with anything, anytime we do anything that our genes don't want us to. With respect to protein, FTO is the gene that really determines how much protein we need. So this individual is normal for FTO. They actually need, so they're the ones with the fastest metabolisms, but they're the ones that need actually the least amount of protein. So they need 0.6 to 0.8 grams of protein for every kilogram of body weight divided into 3. And that gives them the amount of protein per meal. And then there's sort of an example here. If you feed a TT, so the normal, homozygote normal FTO, the amount of protein that the variant A needs, which they need much more, you're going to really increase inflammation in this person. And a really great example of this are the gym rats, the gym buffs, and I'm one of them, so but I don't do what these people do. You see a lot of the trainers or gym rats, they're drinking protein shakes nonstop, before, after, during their workouts, etc. So a lot of them are TT, which is why they're slim and they have a lot of muscle. But you look at their skin, you look at their face, and they're inflamed. And again, they're generally younger when they're doing this. Down the road, this has big ramifications. So we take the same philosophy. There's dairy genes, neurotransmitters. So we have dopamine, which is the production of dopamine and the dopamine receptor, how quickly we clear out dopamine through the COMP gene, how quickly we transport dopamine and also make a secondary level of dopamine, and what would we do in terms of suggestions. Same idea for serotonin. For every hormone, you can't just look at the production of it. You have to look at the production of it, the transportation of it, and the breakdown of it. And that's, again, that integration that GeneRx is giving you. We have similar ideas, so short and long-term stress response. Most of the genetic programs out there, they're only looking at the adrenal genes, but we need to really target the hypothalamus and the pituitary, because that's what's stimulating our adrenals. So NR3C2 and FKBP5, they're hypothalamic and pituitary genes. We also look at how quickly we clear out our stress hormones, and we create a recommendation accordingly. The long-term stress response, are you going to get stuck in that sympathetic side really quickly? Again, we're looking at the amount of cortical releasing hormone receptors we have, and again, the breakdown and hypothalamic receptors. And we have our
other recommendation.
Exactly. Similar.
Yeah, and the thing too, right? Like, I think the best way, like if this is overwhelming anyone who's watching, because we're going through it quickly, the great thing with this report is you don't have to be an expert in these genes. All you have to do to start learning is run a couple of these reports and read what is provided to you and compare them. So once you have a couple of reports and you can compare them, then you can become more in tune to, okay, now I know what that FTO gene, I know what the DRD2 stands for, but you really don't need a strong genetic background because of the amount of education that you get by just running the report and comparing them as you go.
It's funny that the number of docs who are using the report who have emailed me and said they have learned more about genetics just by doing exactly what you said than all the different courses or books that are out there, because it takes the gene and it explains exactly what it does. So our ACE gene, it's converting angiotensin 1 into 2. So we're looking at vasoconstriction. We're looking at the increasing blood pressure. We're also looking at how it plays around with the sodium potassium pumps through antidiuretic hormone. So in terms of exercise, you need a good flush of blood across the muscle if you're going to do in a fast and large amount, if you're going to do high intensity interval training. So if somebody is variant for this gene, so they're an AA, what happens is rather than getting a huge rush of blood across the muscle at once, they're getting this nice slow delivery. So they have lower blood pressure, but they're catered towards endurance sports or endurance training. And if they try to do high intensity interval training, they actually don't
lactic acid buildup.
Exactly, you're exactly right. And so they start to get spasms in the muscles, and similarly, the ADRA gene, this talks about bronchodilation, so how much oxygen are they actually circulating? And again, that's going to dictate for HIIT, you need that intense burst of it, whereas for endurance sports, you need the longer, slower. And then when we look at actin 3, it's how much fast twitch versus slow twitch muscle we have. So do we have the ability to sprint or not? So putting all of those together, for this person, they actually have equal distribution of fast and slow twitch fibers. So the fast twitch fibers enable them to sprint, the slow twitch fibers enable them to perform endurance. So they do have a mix of both of them. They have increased blood flow in large quick bursts to the muscle during exercise and a better control of sodium potassium regulation. In addition, they also have more adrenergic activity, so increased bronchodilation for short, intense exercises more so. So both of these effects make me want to moderate the exercise style a little bit more towards the high intensity interval training. So the muscle fiber type made me want to go a bit of HIIT, a bit of endurance, but because of the oxygenation and blood flow, we want to go a little bit more towards HIIT. So,
and that's key too. I know we chatted about this before we hopped on the recording, is looking at how these genes are interacting together, because there's very rarely one gene that will, it's not straightforward. It's not, if you have this gene, do this. You
right.
really have to look at that web and look at how these are all integrated in order to come up with the best recommendation for them. And this test is great because it shows you the variant and what that variant means, not just a color code, because just because you have a variant that could be good depending on the situation, it could also be bad. So knowing exactly what it means instead of just a color makes a huge difference.
You're exactly right, because sometimes my favorite Goldilocks position for a gene is heterozygote. It's yellow. You know, sometimes the green is actually the adverse position. So knowing what the characteristics are, those key points, such as these of the variant, it also allows you to look at your patient and say, okay, if those are the key points, are you expressing those? Are you actually showing those right now? If you're not, perhaps you've kept it in a good place by doing the right type of exercise or lifestyle, so we don't really need to treat it. But when we look at, again, the recommendations, it's very specific. So you're better with intervals that are longer, slower intervals. So 1.5 to 2 minutes, not the 30-second intervals, and around 70 to 75% capacity with a longer recovery. Alternating that with sort of longer cardio. So it gets really specific again with the treatment protocols. There's a similar thing for weight training. Are you heavy weight and few reps, or are you multiple reps and lightweight? So that will come into injury prevention. Do you break down your collagen, or are you making it at a higher rate? And what's your inflammatory response with it? Immunity. How fast is your immune system jumping on a virus or a bacteria? How is that moderating your response? Is it tipping off autoimmune issues? And when the immune genes get tipped off, they will, just like the stress genes, they will start to unravel a lot of the other genes and push them to their adverse position. So this is the place where this IRF1 gene, which is in terms of autoimmune antibody productions, this person is variant. So this is something that they're going to have increased IRF, increase interferon, increase interleukins, increase cytokines, autoimmune risks, and bowel risks. Even if they're not expressing it at this time, I don't want that gene ever to be expressed. So this would be a place where, again, it's going to describe exactly what this gene means for this patient with their coding. And this would be a place where I do want to actually moderate the production of that. And so again, using colostrum here once or twice a day is a great way to help say to this gene, no matter how much stress is in my life, no matter what viruses or bacteria come into my, don't trigger this gene. And this is where, again, as a patient or as a doctor, we're going to look at it and say, you know what, I'm okay if you don't regulate your leptin. It might make you crave more food today, but I'm not okay if this gene gets turned on. Similarly, inflammation in general. So we're looking at our cytokine production. We want to keep that nice and low. For TNF, one of the major cytokines, this patient is normal. For IL-6, though, they're variant. So they're going to have a lot more inflammation. And as we know, interleukin-6 also has a huge impact on obesity and diabetes and blood sugars, as well as mood disorders. So if you have a patient and they're on, something to increase serotonin and dopamine, and you're not seeing them respond, generally it's because of this guy. Because it's inflaming the receptor. So the best and fastest way to get down interleukin-6, glutathione, and NAC, and taking the two of those together. And again, we have a treatment protocol for about 4 weeks, and then we'll reduce it to half that dose. If a patient is variant for both of these, you'll see the doses are higher. They need to stay on the higher doses for a longer period of time, and then drop things down again.
What about something like curcumin there as well? That's where you could add it into you could edit it and add it.
Absolutely, you certainly could, but you also want to take a look at your phase 1 detoxification genes there. Because CYP1A2, which is a major phase 1 detoxification gene, those people, so this person is normal, so they do, normal here actually means too fast. So that means that they're going to produce too many phase 1 metabolites, which are actually inflammatory and pre-carcinogenic. So one of the best ways to slow down CYP1A2 is with curcumin. So you'll see here in the treatment protocol for this patient, because they were normal here, curcumin is put there. If they were variant for this gene, I would not allow them to be on curcumin, because it means it's too slow, and curcumin would actually slow it down even more so. Caffeine.
And coffee increase. Oh yes, caffeine. Yeah,
Exactly.
She liked that recommendation.
Yeah, thank God that I code this way too, and thank God, don't take away my coffee. So coffee slows this gene down as well. So having 2 to 3 cups of coffee a day will actually reduce my risk of having a heart attack by 68%.
And that's something really important to know too, especially when you're designing a detox for someone. If their phase 1 is already really fast in combination with a slower phase 2, the last thing you want to do is really push that phase 1, because you could often increase more of those reactive intermediates, which is not what you want to do.
Absolutely right. It's actually one of the most inflammatory things that you can do. These genes, these detox genes, are also the ones, of course, that break down a lot of the medications. So if somebody is variant for this gene, ciprofloxacin is particularly active with this gene. It is something that you definitely want to avoid. Those are the people that get a lot of the joint irritation and myalgia from Cipro, the people who are breaking down a lot of their joints with that. Then when we look at phase 2 detoxification, again, we're looking at glutathione pathways. We're looking at the production of free radicals, and we're looking at a secondary NADPH, which is all of the major 5 detoxification pathways this controls. So again, it's how do you interact? They're normal for the glutathione, but they're variant for their SOD2 gene. So that's going to increase a lot of inflammation as well. And don't forget, when you stimulate this gene, you also tip off interleukin-6, which she was also variant for. So again, it brings that inflammatory picture up a little bit higher. They are normal here though. So what do we want to do? We also want to use that same thing to increase phase 2 detoxification, is glutathione and the NAC. One of the other supplements that really decreases interleukin-6 is resveratrol. And in some of the reports, if their detoxification pathways are normal, then I'll just use resveratrol instead of glutathione and NAC to lower the interleukin-6. But to minimize the number of supplements a patient is taking, if their detox pathways are a variant and the interleukin-6 or TNF is variant, I'm going to kill two birds with one stone and use the glutathione and NAC, and that will automatically come up for you in the reports as well.
And it's great too that you can break this up so that you're only showing, you know, to your patient, okay, this is what we're going to work on first, and then you can work on something else secondarily. Because I get really excited and I give the whole report and I want to jump on everything right away, which some people are absolutely on board with, and other people need it to be broken down step by step to not be overwhelmed. So it's great that you can, for your patients who are like, I want to fix everything right now, and they're really excited, like I am, perfect, here's the whole report. And for the other ones that you need to do it a little bit more gradually, you can really break it down and customize it for them and show them, okay, this is what we're going to be doing over the next 6 months. Here's phase 1, 2, 3, etc.
You're exactly right. And, you know, in terms of prioritizing with patients, where do you start? My first place is what the patient walked through the door with. So if they're complaining of weight gain, and I see that their detox pathways are awry, we know the importance of detoxification in terms of the efficacy of weight loss. But if you target just detoxification without targeting their diet and their metabolic section, they're not going to be as happy with you. And if you even leave in the detox pathways slightly untouched, if you get at their leptin, adiponectin, and ghrelin through their metabolic section, and you get them eating their genetic diet, they are going to lose weight. Then you've won them over that way, and then you start to go into the next phases. And I'm like you, I want to do it all at once, and a lot of my patients are like that, but a lot of them we do need to prioritize. And that's also really important with children. I'll have a lot of people asking me, oh my gosh, this was so great for me. Can I do my kids? Are they too young? There is never an age that is too young to start setting your genes in their proper direction. Like, don't let things build up. Don't let patterns, you know, create an adverse reaction in the body. And as we know,
and your genes never change too. So this is, I always tell people, it's a one-time investment in your health.
you got
You
it.
only have to do it once. They're not going to change. But the great part is through epigenetics and diet, lifestyle, proper diet for you based off of your genetics, key supplements, you can influence these genes so that you can stay optimal and stay healthy.
You are absolutely right. And, you know, again, people will also ask me, why did I use 23andMe as the genetic testing protocol? And will I add on other testing protocols? I might do. But the thing with 23andMe is it gives you an extremely wide spectrum of genes for the most economical price. And that's one of the reasons that I went with it. You do need the health and ancestry, not just the ancestry, but the other thing is that the patient can order it. So in Ontario, as a naturopathic doctor, we're not allowed to requisition genetics, but we are allowed to treat and interpret genetics. So if the patient is the one who actually registers the kit under their email, etc., whether or not you have sold them the kit, and we'll get into that, that is independent. It's if it goes under their email, and they can use a fake email, they can use a fake name, it doesn't matter. But as long as it's theirs, then they have ordered the test, not you. And 23andMe, they're on sale all the time as well. Like right now, just for no apparent reason, all of November, 23andMe is 50% off. They will always be 50% off on Mother's Day and Father's Day and Easter and Christmas and Thanksgiving. But right now, it's literally 50% off. So if you're a doc who's going to sell the kits as well, you can purchase a bunch of them at 50% off. You can sell the kit to your patient, say at 75%. So they're still getting a deal for the patient, which means they're going to buy it through you, but you're also still making some money on it. Then they take it home or they spit in it with you, and they create the account. So again, it's, and I've gone through this with our associations over and over. We are allowed to treat and interpret the genetics. We're just not allowed to requisition. Well, we're allowed to requisition 2 genes. just ridiculous. Where are you going to find a company to do 2 genes? I don't know, but The rest of the report it's extremely similar. So it's all the vitamins and minerals, how you code, do you absorb them, do you transport them? These are all the different ones, and then what we're going to do about it, and then estrogen and testosterone. Just going to quickly highlight estrogen because to me it's extremely important, because it's not just about what your estrogen levels are per se, because estrogen, no matter whether you're testing the 2 or the 4-hydroxy, our estrogen levels go up and down 5 times throughout the day, and they almost change about 50%. So it just doesn't give us, and that's independent of whether it's salivary or blood testing, so it doesn't give us a really good clinical picture. Whereas when you look at the process of what's going on in the body, not only can you look at what that might lead to symptomatically, but certainly cancer risks down the road. Because we know that there are a ton of people who are negative for the BRCA genes and they still get breast cancer. And there's a ton of people that are positive for the BRCA genes and they don't get it. So what is going on there is how they convert their estrogen into a dangerous form, and do they clear it out? So CYP17A1 is a gene which talks about how much starting inactive estrogen that you have, as well as progesterone. So if you have more than the normal amount of starting estrogen, you have more that can be converted to a not so good form. CYP1A2 is converting it to the good form, the 2-hydroxy, whereas CYP1B1 is converting it to the bad form, so the 4-hydroxy. So here, this patient converts about 50% of their estrogen to the good form, but 50% to the bad form. So that really increases the risks of polycystic ovary, fibroids, prostatic growth for men, breast cancers, etc. So we need.
And this is so important too, because I see so many people who are on bioidenticals or HRT or an estrogen-based form of birth control, and they have no idea what their genetics are. And for some, that can be completely fine. And for others, it can really, really increase your risk. So it's so important for birth control and HRT to know where these genes stand.
You are exactly right, because somebody who codes normal for CYP1B1 and normal above means they push everything to the 2-hydroxy. You are a candidate if you need it for bioidenticals or HRT. Your risk factor is really small. This person has about a 50% risk factor here, not one I'm willing to negotiate with. So I wouldn't suggest bioidenticals for them, etc. But the biggest thing is, let's push all of that 4-hydroxy into the 2 with DIM. You can use a broccoli protect as well, depending on how old they are, but the DIM for sure. And again, we're going to do a higher dose, clear it out, turn that gene to its best position, and then we're going to reduce down. This is also, something that genetics in of itself is very near and dear to my heart. Not just because I've spent so much time researching it, but literally through aberrant detoxification pathways and treating those, I literally saved my life with it. So it's something that we can have such a huge effect with our patients. It's a one-off test. You never have to retest your genes again, because they will always code the same way. The question is, are we keeping them in their optimal position? With GeneRx, as new genes are added into the platform, they will automatically be updated in those reports. So when you go into your gene file, which will have X number of patients in it, the next time you click on it, it will automatically come up with those new genes. So you'll know each time. And there'll also be a notification sent out that new genes are there. So if you wanted to go on and peek. But it's something that I have seen clinically change my life personally, but the lives of my patients. And I have never heard a patient come back and say, I don't feel like myself again. Like they always do. And you'd be amazed when you start tweaking the different pathways, things and symptoms that they may have experienced from other areas in their life start to clear up, things that we didn't even know that we were targeting. Because the body, as we know, has an incredible innate ability to heal itself. It just needs to be in the right position for it. And that's what it allows us to do.
Love it. And a couple quick questions for you.
Mm-hmm.
How would you go about, how do you start the conversation with genetics with a patient? Is it from the very first initial appointment? Is it, after a little bit of treatment? How do you start the conversation with them?
Really good question. So I actually let it evolve almost naturally. So somebody will come in and say, well, what do you think is the right diet for me? And my answer to them is, I actually really don't know. I could guess for you, but your genes are what dictate it. And I'll give the example of how everybody is not catered towards a keto diet or a vegetarian diet. Or they'll say to me, do you think I should take a multi-B vitamin? You know what? To be honest with you, I could hypermethylate you if I don't know where your genes are. And so I'll use their words to sort of gauge it, or they'll say, it's January 1, I want to do a detoxification program. That's wonderful that you want to do that. But for me, with my aberrant detox genes, every time I tried to do a detox, I would feel horrible. I would get so sick because I was upgrading my phase 1 and I didn't have any clearance out through my phase 2. And at the first time I did it, I thought, oh God, I must be really detoxing a lot. But then I thought, I eat clean, and as I tried detox number 2 and 3, the same thing happened. And now I see why. So whenever a patient brings up something, and I can't give them a clear-cut answer, I have osteoporosis. Okay, this is the formula that I'm going to use for you, even though we can look, we might need to up their vitamin D according to that gene. But most often, everything comes down to our genes. So if you listen to the questions that the patients are asking you, they're gonna lead you into this. Why am I not responding to my antidepressant? Well, it could be because your stress genes are blocking it.
And even with the vitamin D too, like I know personally, I was pretty high dosing myself at the start of the month with vitamin D, and it didn't really serve me. It helped a little bit, but really my genes showed that I had to space out my dosages because of receptors, right? So it's more of a pain in the butt to have to take my vitamin D multiple times a day, but that was the only way that I could really get my vitamin D into an optimal level.
Yeah, you're absolutely right. And so this is all the information that we can give patients, but it's all the questions that they're actually really asking us. I would have to say there isn't one patient visit that, unless it's an acute condition, they're coming in, they're having a UTI. Okay, we know what we do. We're not going to use genetics there. But if there's a family history, if they've been doing a treatment protocol and it's not working, or they're getting recurrent UTIs, well, why is it? Are their inflammatory cytokines up? Are they not allowing probiotics to proliferate, which is one of the B vitamin genes? Do they have a really poor immune response with the 2 genes in the immune section? So there's a lot of different areas that we can look at. Really, just the acute case is the only place where we don't need to go there.
And in terms of marketing this to your patients, I love your suggestions of just having that conversation with them. But also the fact that this can be branded to your own brand is something that I absolutely love, because you can share that on social media. It starts a conversation, as well as you're putting together a brochure for doctors to utilize as well. Could you talk a little bit about that?
Absolutely. So for everybody who's on the call or also up on the website, I'm going to be doing a brochure which basically talks about the benefits of genetics and what we can gain from it, as well as a short little blurb on each of these sections. So what someone would get in terms of metabolics, detoxification, immunity, etc. So just sort of a one-pager. It's not going to have the word GeneRx on there, because I want people to be able to print it off with their logos on it, and also to know that this is a report that you as the doctor is doing. And you truly are. It is you doing the report. I may have provided the guidelines with it, but you're the one who's going to go in to those reports. And just like with estrogen here, I'm going to edit it and say, this patient is 10 years out of menopause, and we're going to change it because of this. So that is you as the doctor overseeing it. So that was the reason I don't want GeneRx on there. It's all going to be about you and your practice and your patients. But it at least give a quick blurb that you can put in your waiting rooms for when your patients are waiting to pick up and read. And then that also may stimulate them to walk through your door and say, hey, what is this? Or, how do I go about this?
Hmm. And I have a structure in my practice of how we're going to run it with, the first step is initial consultation because we need to know, are you expressing these genes? What is your diet and lifestyle right now? Then after they've run the test, we're going to do appointments based off of the follow-up. And we've priced that in a way that works with the GeneRx and with our practice. But do you have a general recommendation about pricing and costs and how one would roll this out in their practice?
Absolutely. So you definitely want to recoup the $250 for the cost of loading up into GeneRx. So that is a given. I charge $600 for the genetics report. So that is my time, my energy, my editing. I used to hand type up all of these, and that's originally where the 600 came from. It took me so long. But this is invaluable information that you are going to give your patient. It is everything that they pretty much need to know going forward for the rest of your life. So do not undersell it. And in terms of your cost, it is a one-off. Yes, you will do follow-ups with them, but this is information that they will have forever and essentially will not change. So I've been doing genetics for quite some time, so I feel comfortable charging that amount. Again, I'm in Yorkville, so that also makes a difference, but I wouldn't charge any less than $500 for that. I also charge for my consult fee on top of it, but that's also your call. But my suggestion is never to go below $500 for charging for the report.
Perfect. Okay. That makes
And again, don't
absolute
forget,
sense.
you also have the supplements, and that's another big selling point, because compliance, and this is actually research showing this, compliance is 87% when somebody does genetic testing versus 35% when they don't, in terms of sticking to a diet or taking a pill, etc.
I see that all the time. I'm always test, don't guess. Not only do they understand more about why they're taking something, but like you said, the compliance is just so much better when they have that physical proof in front of them showing exactly why you're needing to take this.
And so is the sales of your products to go with it. So for instance, Dimavail, this patient, in my opinion, should be on this every day for the rest of their life. And so it's when you say to somebody, I need you to be on this for the rest of your life to prevent cancer. And again, it's one capsule, their maintenance dose for this individual. It is repeat sales for you as a doctor without having to do any work. And again, that's where you can go and prioritize. And some of the supplements, like the TMC, they're rotated in. It's not on a daily basis. That depends on which the genetic section is. But your income also substantially increases because of the repetitive sales. And I have seen patients do it, and then they go away and on summer holidays, so they go up to their cottage for 2 months and they just didn't take them with them, and they didn't want me to FedEx them out to them or whatever it may be. They come back and they don't feel nearly as well. And even if they've experienced that, you've now once again got them for life, because they know what it feels like to be on them and they know what it feels like to be off them. And I know it personally. I know what it feels like when I'm on my key nutrients, and I know what it feels like when I'm not. So it's something that we're offering an incredible service to our patients, but it is a good generator in terms of our practices.
And it really streamlines exactly what to do with each patient at what time to having a full report with something like this. And if anyone has any questions, I'd invite you can either unmute your mic or you can post in the comment section if you have any questions specifically about GeneRx or any questions in general. We're happy to answer them while we're on here. And in addition to that, is there resources, or how can they learn more? Is the best place to go to generx.ca and sign up for an account?
So that truly is the best way, because that's where you're really going to learn about the genes. When I lecture on genetics, I'm asked this all the time. And I used to send people to different websites like Snipedia and Omni, because they'll also have all the clinical studies. But one thing that I will show you, when we're going through this report, once you've made all the changes, you hit view PDF, it'll automatically put it into a PDF file, and then you can download it and save it. But if we go back to, once you are in this, once you've signed up for an account, you will now have a different section called Gene Reference. Gene Reference is not on there until you have an account. And this is all this clinical studies behind each of the genes that are in there in alphabetical order. So you can see how many there are, but it's another way that you can go on, read about the studies behind it, and then read about and learn a little bit more about the genes themselves.
Perfect. I think that's a great resource. And like I said, just from my own personal experience, it can be overwhelming to get, there's so many genes and it's so hard to know which ones do what, and is heterozygous good or is it bad? And really running the report with the amount of detail that you've included and going through a couple patient cases is the best way to learn.
Absolutely. And just, go straight to that recommendation section and say, okay, for instance, this one with fats, on whenever you consume fats, you release a little bit more ghrelin, and just get it very simple again. Okay, so we're releasing more ghrelin. What do I need to do? I need to reduce my saturated fats to 28 grams. Okay, what does that look like? Here's a bunch of examples. So you can
that can be counterintuitive too, right? Because we're always thinking, okay, fats provide more calories, you should be full, but it's not the case for everyone. And I've seen that in my metabolic reset program and my clinical practice, that for a lot of people, looking at the amount of fats that they actually need to consume makes a big difference.
Makes a huge difference, as well as saturated versus unsaturated. And that's the beauty of genetics. There isn't, I've written 5 books. I don't even keep any of them in my office anymore because they're obsolete. It really comes down to our genes. I do have a new book on genetics coming out this year, but that is how we can't cookie cutter treatment protocols anymore. And patients are asking for this. They know about it, they want it, and I'm thrilled of everybody who is on this call today and listening to this, because you're the people who are going to be rising above all of the other practitioners who don't want to learn about it or are frightened by it. And using GeneRx, it helps to simplify it and make it easy. And if you just want to start with one section, you just want to start with their diet, what do they really need? Okay, let's just learn those 3 sections, and that's it. So you can make it as simple as you want and grow it as you start learning.
And like you said, patients are asking for it. If you look at the sales of 23andMe, people are running their genetics really, even without this education, wanting to know more than just what the 23andMe gives them.
Exactly. There isn't anybody overseeing the reports for 23andMe. So there is, that's why there's no treatment protocols with it. There is also, again, you're getting some of the risk genes like the BRCA gene, but it's not telling you about your CYP1B1 and whether you turn things into 4-hydroxy, and is that going to stimulate your BRCA gene? And that's what's key.
It makes so much sense. Amazing.
Wonderful.
Is there anything that we missed that you wanted to add on the reports? I think we did a pretty good job at covering everything.
I mean, we sort of, skimmed through some of the sections, but again, on the website, you will get a good indication, a brief overview of what's in all of them. But it really is about going in and, even if you upload your own 23andMe first, because I find that's how I really learned, was on myself first, because I could see that, oh God, yeah, every time I do this, this is why I feel this way. And it's a lot easier. You learn it faster, because when you experience it yourself, like, oh God, I'm never going to forget that gene now.
Yeah. And your patients sometimes think you're psychic too, when you can really chat about, so are you more prone to addictive tendencies?
Exactly.
Their eyes just light up. So Thank you so
Exactly.
much for taking the time to walk through the back end, showing us exactly what this report shows and how you can edit it. I absolutely love the concept, and I really, really appreciate all the time and the details and the specifics of exactly how much protein, carbs, and fats, exactly how much of the supplement, and looking at all of these genes as interconnected in a web instead of just in isolation makes a huge difference. So thank you for everything that you're doing. I look forward to your book. And if anyone has any questions or you want access to the replay, if you've hopped on a little bit later, we have recorded this. And if I can figure it out from a tech standpoint, I hopefully will have that link for the replay later today. So you're welcome to just send me over an email or a message and I'll get that recording for you as well.
Fantastic. Thank you so much for this. And thank you for sharing your lunch hour with me.
Thank you. We'll talk soon.
Take
See you,
care.
everyone.
Bye.